My name is Eric Curtis, and I will be doing my portion of the HEENT exam for Nursing 383. I'll begin the assessment by washing my hands, doing an introduction to my patient, and doing a brief explanation of the following exam. I'll begin the exam by doing an overall general assessment. I can see that Betty is holding herself erect on her own very well without any swaying side to side. She appears well nourished and hydrated, does not appear to be in any acute distress. In speaking with her, I can see that her speech pattern is regular. I can assess her level of consciousness and her mental state as well. Moving on, the skin and nail exam has been included into this exam. It's important to know that only the portion of the body that is to be assessed will be disrobed during that time. Skin will be assessed for color, any lesions, palpated for tenderness, and masses that may present. Nails can be inspected for signs of bluish color, cyanosis. Capillary refill can be assessed and should be within less than 3 seconds. Then any nail abnormalities can be assessed, such as clubbing or cupping. Moving on with the exam, we would do head and face exam. So we would begin by palpating and inspecting the scalp, noticing any dry skin or lesions. If lesions are present, we would of course have gloves on. We'll assess any abnormal hair distributions patterns or any types of hair damage. Moving on to the facial exam, we will inspect for symmetry from side to side and notice that there is no facial drooping of any kind. I'll have Betty take her glasses off for me. We will palpate, inspect the face as well for color, and note that color is symmetrical with her shoulder area. No redness or pallor noted, or any lesions. So we would palpate the facial bones for any tenderness, any abnormalities. We can check for the temporal mandibular joint by having the patient open wide and then close. And we are feeling for a click. If there's a click, then that is an abnormal finding. Sinuses can be palpated. The frontal sinuses will be palpated to elicit a tenderness response, and then the maxillary sinuses as well. Moving on to the eye exam, we'll inspect the upper eyelids and the lower eyelids bilaterally, and the conjunctiva, noticing any redness, swelling, any drainage that may be present. We'll inspect the eyebrows and eyelashes for hair distribution, making sure the hair is distributed across the whole eyebrow area and eyelash. And then the sclera and the iris will also be assessed for color, noticing any redness or yellowing of the sclera. Moving forward then with the exam to the ears, we will inspect the outer ear and surrounding area on both sides. Again, for skin color, any presence of lesions, and any external ear drainage. We can then palpate around the outer ear, checking for firmness and recoil of the ear, and palpating for tenderness. The inner ear would be assessed with an otoscope, which I do not have. However, the otoscopic exam allows for the visualization of the tympanic membrane. We would also note any redness or drainage of the inner ear, type and amount of cerumen buildup in there as well. Providing the tympanic membrane is translucent, we should be able to visualize parts of the malleolus, the umba, and the manubrium within the inner ear. Moving forward to the nose, again we will inspect the nose for symmetry, side to side, skin color, any presence of lesions. We can palpate the nose for tenderness and crepitus, and there is none noted. The inner nose would be assessed with an otoscope once again. We'd assess for any internal drainage, internal redness. We'd also check for septal deviation or septal perforation. We can inspect the turbinates, noting any abnormalities, redness. We test for nasal patency. I'll have the patient plug one side and breathe in and out for me, and then the other side, and nasal passages are patent. Moving forward with the mouth and pharynx exam, again checking for symmetry, no droop of one side of the mouth or the other. Lips are nice and pink, no open sores or lesions noted. So we'll inspect the inner part of the mouth, the tongue, the oral mucosa, and note any redness, lesions, abnormal white spots, anything of that nature. I'll have the patient lift her tongue to the roof of her mouth, noting the frenulum, noting any lesions under the tongue, and that is good. We can have her say ah, and when the uvula is midline and moves up and down appropriately. Tonsils can be inspected, noting any redness. They can also be graded. 0 is non-inflamed, and +4 would be referred to as kissing tonsils, and where they were almost like touching. Moving on to the neck assessment. We again would inspect the neck on both sides, checking for redness, noting any carotid pulsations that might be visualized, or any other masses. Palpation, palpating for any tenderness or masses. The lymph node chains will be palpated for warmth, tenderness, and swelling. So we'll have the preauricular and the postauricular and the occipital, the tonsillar, the submaxillary, the submental, and we have the anterior cervical chain, the posterior cervical chain, and the supraclavicular down here. Again, we would be noticing any swelling in those and the amount of swelling noticed, and if there's any tenderness. Carotid pulse would also be assessed, of course one side at a time. We'd be assessing for the quality and regularity, and for the presence of a thrill on both sides. If there was a presence of a thrill, then one could auscultate for the sound of a bruit. That concludes this portion of the HEENT exam. So I will finish up by washing my hands and thanking my patient, my mother-in-law Betty, and my videographer, my wife Tammy. Thank you.